Thank you for being here on this last day of the conference. I'm very excited to present this work on extreme heat and fertility in Nigeria. This is joint with my co-authors listed here, and it's very much still a work in progress, so I'm looking forward to your comments and your feedback. So I don't really need to motivate why this topic is important on day 3 of this conference and after 2 presentations on climate change and fertility intentions, so I can go through this a little quickly. We all know that climate change is increasing the intensity and frequency and severity of extreme heat events, but our ability to study these impacts in low-income countries has been hindered a bit relative to Europe and other places by a lack of good ground-level monitoring data on temperature in these settings. We've seen a lot of different presentations throughout the last few days on a lot of different demographic processes, and we heard a wonderful talk already this morning. And so relative to some other demographic processes like migration and mortality, the impact of extreme heat or climate change more broadly on fertility is much less studied. But for changing fertility may be an explicit adaptation strategy that women or in households are engaging in, and also if it affects women's ability to conceive at all, then it's sort of an important concern related to reproductive autonomy and choosing when you have pregnancies. So this study is set in Nigeria, and so when we're thinking about in the context of sort of low-income countries in the tropics, they face a triple burden when it comes to these issues. So there's high levels of climate vulnerability, but there's also still high population growth and high fertility. And then in general, these countries are quite poor and have weak health systems and limited abilities to adapt and cope to extreme temperatures. So although the effects of extreme heat on fertility have been less studied than other things, there is still some evidence, and a lot of it comes from people in this room. And so we've seen that extreme heat exposure adversely affects pregnancy outcomes, such as preterm birth and birth weight and miscarriages. And we've also seen that extreme heat reduces, in some contexts, or delays births. And then this last one is a little bit more related to the low-income country setting, but we've seen that fertility preferences or fertility intentions have also been impacted in some cases by extreme heat exposure. But that's really a smaller and more growing body of literature. And so across this sort of growing space, there are a number of gaps and methodological issues that exist, and some of them were touched on earlier by Kat's talk. But many of these studies sort of draw on the classical determinants of fertility, looking at potential biological and behavioral pathways that extreme heat or climate change more broadly could be impacting fertility. So there's many biological pathways, such as changes in disease incidence, nutrition, sort of direct impacts on fecundity, and thermal stress during pregnancy. And then also a lot of behavioral channels, and I think we often are trying to tease these apart or identify which ones matter, which is really complicated in this space because they interact in complicated ways, and sort of the arrows go in both directions. And then there's also a lot of methodological challenges in studying the effects of extreme heat on fertility, and maybe demographic processes more generally. So thinking about critical exposure windows in terms of when does this matter with respect to decision making and outcomes. And then this issue of acute versus chronic exposure windows or chronic exposure, and also acclimatization to increasing levels of just heat that's getting hotter and hotter and lasting longer and longer. And then the last thing is sort of differential impact of humid heat from dry heat, and also just different ways of characterizing heat exposure. We've seen a couple different talks, and sort of everyone defines these things differently. It often depends on the data that you have. And so these things really impact our sort of ability to come to I think, consensus around some of these impacts. And I'm not pretending to answer any of these questions with this study. So what we do in this paper is we will focus on Nigeria, which is one of the most climate vulnerable countries in the world. Exposure to hot, humid heat has been rising rapidly. And in Nigeria, you have a really strong north-south gradient in terms of the temperature, precipitation patterns, ecological zones, and livelihood strategies. Nigeria is also the most populous country in Africa, and fertility remains high in our sample. The average parity is around 4.4 children per woman. So it's an important context in which to be studying these questions. And so we're going to examine the effect of several different definitions of extreme heat exposure, and also look at 3 different fertility outcomes: conceptions, terminations, and live birth, to try to get at a little bit some of these different mechanisms that are at play. And then we'll also do some heterogeneity analyses and look at some intermediary outcomes to further sort of try to get at or explicate some of these mechanisms. So in terms of the data, we rely on two primary sources of data for this analysis. On the fertility side, we'll use the Nigerian Demographic and Health Survey's data. We use both the birth history data, of which there are more waves available, and then we also use 2 waves of the fertility calendar data, which is what allows us to actually identify the month of termination and also conception and live birth. So although it's a little bit more limited in its availability, it allows us to look at these outcomes, which otherwise we wouldn't be able to look at. And so we're going to, again, define conception, termination, and live birth. And I'll be focusing just on our work with the fertility calendar data today and what I'll show you. And so we collapse this for this first analysis down to the woman year level. And that leaves us with a little over 400,000 woman year observations. And then importantly, we're going to restrict our sample to the length of time that women have lived in their current residence so that we can ensure that they're actually exposed to the heat that we're going to be linking up. Then in terms of the heat data, we're going to work with the Climate Hazard Center's CHIRT's daily temperature record, which is sort of the most accurate temperature record for data-sparse regions like sub-Saharan Africa. And we will combine this with a relative humidity measure to approximate wet bulb globe temperature to capture the effects of humidity and heat together. That's supposed to be a degree sign. We're going to then construct days above 30 degrees Celsius for each DHS cluster. And then we're going to spatially merge that into the DHS data. So our heat data, we started at approximately a 5-kilometer spatial resolution. And then we will construct 10-kilometer buffers around each DHS centroid and spatially merge and average those in. And then we're also developing another extreme heat data set, which I won't be able to present today yet, but we're going to sort of identify heat waves and characteristics of those heat waves in terms of the intensity and duration for a sort of more temporally granular analysis that we'll be doing. So to begin with, just some descriptive results. We can see that humid heat has been rising substantially in our sample over the last 30 years. I don't think I'm going to try to use the pointer, but in the 1980s when our heat data begins, each cluster is sort of on average experiencing around 10 days per year. And then on average that goes up to over 30 days per year by 2016, which is when our heat data ends. Then also still just descriptively, plotting the relationship between days above the 30 degrees Celsius of wet bulb globe temperature in the previous year against conception rates measured as per 1,000 women in the current year. And so what we see is that as heat increases, there's sort of a linear rise in the conception rate up until we hit around 80 days per year of hot days, and then it sort of levels out. But the pattern for terminations is quite different. So here we see an inverted U-shaped pattern where the termination rate rises pretty steeply up until it peaks around 30 days per year that exceed 30 degrees Celsius, and then it starts to decline. So our current empirical approach will, oh dear, sorry about that, will include a fixed effects regression specification. And so we're going to be looking at the effect of extreme heat in the previous year when all women would have been exposed to it, and be making fertility decisions that will impact their fertility in the current year. And then we'll use DHS cluster and year fixed effects. And then also control for some individual level characteristics that affect fertility. So we include age, parity, marital status, education, and religion. So just to give you some preliminary results, here I'm plotting the marginal effects from the regression specification for conceptions on the left, terminations in the middle, and then births on the right. And then because the marginal effects are pretty small and maybe hard to sort of contextualize, I've converted them to a percentage change relative to the sample average just below the labels. So what we can see is that the experiencing extreme heat in the previous year has a sort of small and negligible, statistically insignificant effect on conceptions and births, but we do see a statistically significant effect on the probability of termination. And so this implies that for each additional day above 30 degrees Celsius in the previous year, we see a 1% rise in the probability of a termination. On average in our sample, communities are experiencing around 16 days per year above that 30 degrees Celsius cutoff. So that would imply that we see a 16% increase in terminations following a hot year, an average hot year, which already is a pretty large effect. So, and that's again just for average in our sample. So just to sort of preview, I guess, some of the heterogeneity that we'll be exploring in more depth. On the left, I'm plotting the conception rate separately by urban and rural, women that live in urban and rural areas as classified by the DHS. And then on the right, the similar plot for terminations, where women that live in rural areas are shown in the red line. And so what we see on the conception plot is that the effective heat seems to be a little bit stronger for women living in rural areas. It rises more linearly up to, again, that 80-day threshold and then levels off, whereas the entire relationship is much flatter for women living in urban areas. So that suggests that there might be more than just biological pathways at play. On the other hand, for terminations, the effect for women living in urban and rural areas is almost the same until we see, again, a sort of a really hot year, over 80 days of, that exceed 30 degrees Celsius. And then the patterns diverge quite strikingly, where women in rural areas see a sharp rise in terminations, and in urban areas we see a decline. And so that could certainly be indicative of differential access to healthcare or other coping mechanisms to adapt to extremely hot weather. So just to sort of, I guess, summarize what I've seen so far and highlight some next steps. So we've seen that the experience of extreme heat in the previous year does not seem to impact conceptions or births in our sample, but does impact terminations. And just descriptively, there are some striking differences by residents in an urban or rural area. So we'll be doing heterogeneity analysis, looking at that more deeply, and also looking at heterogeneity by parity to understand how this affects women differentially according to how many children they've had. And then also we'll look at sort of differences according to whether or not women have recently lost a child or a pregnancy to get at one of the commonly proposed mechanisms in the literature around sort of wanting to replace a lost child or a perceived risk of losing children. Then we do plan to explore some intermediate outcomes related to fertility intentions and contraceptive use to try to examine some of these behavioral mechanisms. And then given the descriptive plots that we've seen, we'll definitely be exploring some nonlinear specifications. And then once our extreme heat wave data set is ready, then we'll be running some discrete time event studies to look at the time to fertility outcomes following an extreme heat event. And so thank you, and I look forward to questions.